Hello, I'm Dr. Poornima, one of the consultant in OBGYN in Aster, RV, JP Nagar branch. So today I'll be talking on one of the most common topics, painful periods. What is painful periods, otherwise in medical terms called as dysmenorrhea? There are two types, primary and secondary. Painful, what might be painful for one might not be painful for the other. What is painful? So someone who can carry out their day-to-day activities and not interfere much in their work might not be painful. And what is the type that it could be? It could be continuous, it could be intermittent. Most of this period kind of pains is intermittent and what we call in medical terms as spasmodic. It comes and goes, a squeezing kind of pain. And it's not pricking or it's not stabbing. That could be pointing towards something pathological or something wrong in the system. So what are the causes of the primary dysmenorrhea or what we call as painful periods? It could be because the mouth of the womb, that is the cervix, might be, then a canal might be narrow, and the painful periods because of the painful spasms of the muscles of the uterus, the muscles of the womb. So this can be relieved by painkillers. And is there anything wrong about this? Are these painful periods bad? Not at all. It sometimes decreases with age as one gets matured. The hypothalamo-pituitary axis, that is the brain signals that develop and mature these organs over time, these periods become painless. Now another question is which women mostly ask is, are painless periods good? Again, in the beginning when a woman attains menarche, her first period, in the initial days the periods are painless. Then when ovulation begins and starts maturing, the axis starts maturing, periods can get painful, and over time sometimes they lessen down. But there is a certain set of people where period pain goes on increasing with age and after delivery as well. In such conditions, we have to rule out certain pathological conditions called as adenomyosis, where there can be bleeding in the wall of the womb or the wall of the muscle, uterine muscle. So this is known as adenomyosis, where the uterus size can get bulkier and heavier in size. So such condition needs to be ruled out. So what is painful period? It can be associated with heavy bleeding as well. So if there's heavy bleeding, what do you mean by heavy bleeding? Changing more than one pad in 1 hour, or waking up at night to change a sanitary napkin, or more prolonged bleeding of more than 1 week, or it is associated with severe pain that day-to-day activities cannot be carried on, then you should meet your healthcare provider and get yourself checked. Thank you.